my name is Carolyn Brown. I'm an occupational therapist in the outpatient rehab department at the Hospital for Special Care. Today we're going to be going over some self-treatment and self-management home exercises for spasticity. Spasticity is caused by an incorrect signal from the brain and the spinal cord to the muscles of the body. It's due to damage caused by a stroke or a brain injury, spinal cord injury, as well as other conditions that can cause these incorrect signals. The symptoms that occur due to spasticity are muscle tightness of the arm or the leg or both arms and legs, spasms, pain, and involuntary jerky movement. So these exercises shouldn't produce any pain. If they are, that means you should lessen the amount of stretch. So let's get started. The first exercise is shoulder blade pinches. What you're going to do is imagine there's a pillow between your shoulder blades on your back, and you're going to pinch your shoulder blades together onto that pillow, and you're going to hold it for 5. 1, 2, 3, 4, 5, and you're doing that exercise 5 times. The next exercise are shoulder circles. What you're going to do is big circles going backwards with both shoulders. And you're going to do that 5 times, okay? The next exercise is you're going to clasp your forearm of your affected arm, or if you can try to clasp your hand, that would be even better. You're going to straighten your affected arm out as much as you can, and then you're going to raise your arm up over your head as high as you can. If you can't get up over your head, that's fine. Again, you don't want to produce pain, just a stretch. And you're going to raise it up. Good. And then hold it for 5. 1, 2, 3, 4, 5, and then down. And you're going to do this 5 times. The next thing you're going to do is you're going to take your weaker arm or the affected arm, and you're going to cradle it in your stronger arm. So you're going to cradle it by holding your elbow. And what we're going to be doing is sitting up really tall, and we're going to be raising your arms up towards your forehead. If it's too difficult to get that high, that's fine. You can just go to your chin, but ideally you're going to want to get as much of a stretch as you can. So on the count of 3, raise up. 1, 2, 3. Good. And back down again. You're going to do that 5 times. The next exercise is you're going to take your affected arm and place it on the chair next to you. Then take your unaffected arm and reach behind and try to clasp your forearm. Sit up really tall, and then you're going to try to pull your affected arm across your back and hold it for 5. 1, 2, 3, 4, 5, and you're going to be doing this 5 times. So the next exercise is we're working our way down to your elbow, a good bicep stretch. So you will need a table for this exercise. Your kitchen table would really work best. And it's always good to be in a chair with 2 arm rests. So you're going to be placing your affected hand into your unaffected hand, either clasped hands or grasping the forearm. And you're going to be stretching straight across the table. And give a good stretch to your elbow. You're going to take a nice, slow, deep breath. And as you exhale, sink into that stretch. And you're going to hold it for 5. 1, 2, 3, 4, 5. And the next thing you're going to work on your forearm. You're going to rotate your palm up of your affected arm, keeping your elbow straight. And give that nice, slow, prolonged stretch for 5 seconds. 1, 2, 3, 4, 5. And then you're going to rotate onto the other arm. 1, 2, 3, 4, 5. Okay? You're going to do each one of those, each direction 5 times. Okay? Now we're ready to work on the wrist. For the wrist, what we're going to work on is you're going to, with your arms on the table, you're going to give a little pull, sort of like you're trying to pull your hand right off of your arm. Give a little bit of a pull for distraction, and then extend your wrist back. And you're going to hold that stretch for 5. If you have difficulty doing that, what you can do is you can use the end of the table for leverage to give the stretch, or if you want, you could use your knee as leverage to get a good stretch. So again, you're pulling your hand and then you're extending your wrist back and holding that stretch for 5 seconds. 1, 2, 3, 4, 5, and you're going to do that stretch 5 times. Okay? What we're going to be working on is what they call deep tendon pressure and deep muscle massage. Both of them will help reduce spasticity in the affected arm. The first massage that you'll be doing is in your pectoral muscle. So what I'd like you to do is to take your affected arm and put it down by your side. You're going to be feeling that muscle that runs into your armpit. That's your pectoral muscle. And I just want you to take the other hand and do a deep massage into that muscle that's tight, making sure you're sitting up tall while you're doing it. Okay. The next massage is you're going to be placing your arm, either you can place it on the table or you could place your arm between your knees, and you can stabilize your hand between your knees just to keep your elbow as straight as possible. And you're going to do a deep massage right into your bicep muscle. And then you're going to take your hand and you're going to run that deep massage straight down the underside of your forearm, right down to your hand. And you could use massage lotion if that works best for you, but you don't necessarily have to. Again, you want to feel no pain, but you do want to feel a stretch. Okay? Now we're working our way down to your wrist. Again, we're working on that distraction. So we're trying to pull, like you're trying to pull your hand right off of your forearm. I promise it won't fall off. You're just giving a pull for distraction. Okay? And then the next one is you're going to take each finger, and again, you're trying to pull each finger to give a little bit of distraction, to stretch out those tight joints. Next thing you're going to work on is all you need from your house is a simple soft bristled hairbrush. So if you could find a soft bristled hairbrush, you're going to place your affected arm just in your lap, and you're going to slowly do deep brushing of your arm, starting at the shoulder, working all the way down to your fingertips, and then slowly back up again. You don't want to do it quick. Slow, deep brushes. And then you're going to flip your arm palm up and do the same thing on the underside of your arm. If you can find a surgical scrub brush, even better, but ideally just a soft bristled brush works very well also. So the next set of exercise involves spasticity self-treatment of the trunk and the pelvis. So spasticity not only can affect the small muscle groups of the arm and the lower leg, but it can also affect the larger muscle groups in the trunk, the abdominals, and the pelvis. So the first thing we're going to be working on is what they call pelvic tilts. So what I'd like you to do is you're going to sit up as tall as you can, stick your chest out, head up to the sky, and rock your belly button forward, okay? And then I want you to slouch down and look at your belly button. We're going to do this 5 times. Straight up, stick your head up, good, and then down. Always good to breathe while you're doing it. The next exercise is weight shifts. So what I'd like you to imagine is you have a deck of cards and you want somebody to slip a deck of cards right underneath your hip on one side. So you're going to rock onto your left hip and try to lift up your right hip and hold it. Good. And then try to rock onto your right hip and lift up your left hip and hold it. Okay, again, you're going to do this 5 times. And the next exercise is trunk rotation. So what you're going to do is with clasped hands or clasped forearm, you're going to look at the, turn yourself completely looking behind you. So sort of like you're trying to look at the car behind you. You're going to rotate to the right and look behind you. 1, 2, 3, 4, 5. And then rotate to the left and look behind you. 1, 2, 3, 4, 5. Again, you're going to do this 5 times. 3. Now the next step is putting all these movements together. So in order to put these movements together, we have to think about, well, what is it going to be used for? Well, for you, it's going to be used for scooting forward in your chair in this case. So what I'd like you to do is to practice with your hands clasped, scooting 1 hip at a time forward in your chair. Good. And then 1 hip at a time back in your chair. Now we're ready to transition into a squatting position. So what I'd like you to do is to put your feet on the floor, nice and even, shoulder width apart. So we want to make sure your left foot, your left toe matches your right toe, okay? So again, feet shoulder width apart. You're going to clasp your hands. You're going to, on the count of 3, we're going to come forward into a squatting position. It might be better if I turn the chair so you can see it from this side. Okay, and then a count of 3. 1, 2, and 3, and you're going to hold it for 5. 1, 2, 3, 4, 5, and back down again. Always be standing from a chair that's either locked or has armrests, or you have someone nearby if you need to for safety. Work on the squatting position with weight shifting. Okay, so what we're going to do is to come up, hold it, and then we're going to rock onto our right foot and then onto our left foot. 1, 2, 3, 4, 5, and then back down again. Okay, I'm going to do that 5 times. So the next thing we're going to do is to come up to a full stand. We're going to again clasp the hands on the count of 3. 1, 2, and 3. Come up to a full stand. What I'd like you to do is to make sure there's a table in front of you, a chair behind you. These are weight-bearing exercises for the arm, but they're also anti-spasticity exercises for the legs. So all you're going to need for the table exercises is a tube sock and towels. What I'd like you to do is to take towels, roll them up into a roll and stuff them inside your tube sock. But what the tube sock does is it prevents you from overstretching your fingers when you put your hand flat on the table. If you are able to get your hand flat on the table, that's fine too. But if you have difficulty getting your hand flat without causing pain in your wrist or your fingers, definitely use the roll. So you're going to place your hand right on the towel roll, like this. You're going to try to straighten your elbow out as much as you can. Place your other hand on top of your hand, or you could place it next to it. And the first thing we're going to be working on is just rocking forward and back onto your hand. Again, trying to keep your elbow as straight as you can. We're going to do that 5 times. We're going to practice rocking side to side 5 times. And now we can work on your legs a little bit while we're in this weight-bearing position. You're going to be kicking your legs out 1 at a time, out to the side, 2, 3, again, 5 times, 4. And the next thing you're going to work on is donkey kicks. So sort of like you're trying to flex your knee up. So you're just lifting your heel up towards the ceiling, not your whole leg. The next one is just regular marches. So we're going to work on lifting your knees up as high as you can. Again, while you're weight bearing through your hands for support. And lastly, you're going to work on your ankles a little bit. So what I'd like you to do is you're going to rock back onto your heels and then rock forward onto your toes. Back onto your heels, forward onto your toes. And those are the Spasticity self-treatment exercises. You can perform these 1 to 2 times a day. Again, try to perform 5 repetitions each. You don't want to be feeling any pain, and also make sure that you're in a safe environment with someone standing nearby if needed. Thank you very much.